Because of the known harmful effects of spasticity, a number of current treatments are used. They are physical therapy and braces, oral medications, Botox injections, orthopedic surgery, baclofen pump, and selective dorsal rhizotomy. Physical therapy is well known to you. We believe that physical therapy can help reduce orthopedic deformities and help children learn motor skills. Several medications, such as baclofen by mouth, are used, but the beneficial effects of these oral medications are still unclear. Also, we are concerned about the side effects of medicine on the child's growing brain. For these reasons, our center does not favor the use of oral medicines. Botox has become popular in the past several years. Botox is frequently injected into a few muscles of the legs. It can reduce spasticity by weakening muscles temporarily. Although the beneficial effects are often obvious, the main disadvantage is that the effect lasts for only 2 to 3 months, and repeated injections result in weakening of the muscle over time. Muscle and tendon releases are often used. The orthopedic surgeries can improve joint range of movement, sitting, and walking. Orthopedic surgery is the best choice for fixed deformities. However, there are significant disadvantages associated with traditional muscle tendon lengthening, including permanent weakness of lengthened muscles, risk of over-lengthening, and the surgery often needs to be repeated as children grow. It is important to know that muscle and tendon releases do not address a root problem of spastic cerebral palsy, namely spasticity. Rather, it addresses the result of prolonged spasticity. Percutaneous muscle tendon surgery is a conservative approach to muscle lengthening. It is done through a small opening in the skin where a controlled lengthening is performed. There is significantly less risk of over-lengthening the muscle with this technique. Patients require no casting and in most cases no hospital stay. For baclofen infusion, a pump is placed in the abdomen and the pump is filled with baclofen. The pump slowly injects baclofen into the spinal canal. This treatment can reduce spasticity. An advantage is that it does not require cutting nerves or muscles. Disadvantages of the pump are the high rate of complications associated with this treatment. The pumps must be maintained to work properly. Periodic visits are required to fill the pump with baclofen and to adjust the dose of baclofen the patient is receiving. Repeated surgeries are required periodically to replace the pump before the battery life is exhausted. Spasticity returns if the pump infusion is stopped. Selective dorsal rhizotomy is a neurosurgical procedure that reduces lower extremity spasticity in patients with specific types of cerebral palsy. Our center has been performing selective dorsal rhizotomy since 1987. It is now clear that selective dorsal rhizotomy is an excellent option for many children and young adults with spastic cerebral palsy. For selective dorsal rhizotomy, an incision is made on the back. A small section of the back part of the bone is removed from the spine, and the sensory nerves of the spinal canal are exposed. Each of the sensory nerves are tested to determine if it contributes to spasticity. Some of the nerves are cut. Our dorsal rhizotomy procedure is less invasive than other procedures and has several important advantages. The most important advantage is greatly reduced risk of future spine problems. In fact, we have seen only 2 spine problems in our patients since we started performing this procedure in 1991. Both children required surgery to correct the problem. We have further modified the dorsal rhizotomy surgical technique to reduce the risk of these problems in future patients. In our patients, there is minimal motor weakness for only a few weeks after surgery. After other dorsal rhizotomy procedures, patients always show weakness for more than a few weeks. Patients recover rapidly after our dorsal rhizotomy procedures. Regular, vigorous physical therapy is resumed soon after surgery. Dorsal rhizotomy is a complex procedure and carries risks. The major risks are paralysis of the legs, including permanent and complete paralysis, sensory loss in the legs, loss of bladder and bowel control, impotence in males, and infection such as meningitis. The complications are in general apparent within a week after surgery. Other complications may include spinal fluid leak. If spinal fluid leak occurs, the leak site may need to be closed in the operating room. The surgical technique has been further refined to decrease the risk of spinal fluid leak. Other minor risks are those associated with general anesthesia, pneumonia, wound infection, and bladder infection after surgery occurs,